This is going to be given by Dr. Rajeev Jayadevan. Now, Rajeev Jayadevan is a gastroenterologist. He was an undergraduate in CMC Vellore in the year 1986. After that, he was postgraduate, then went on to do gastroenterology training, and he has actually several excellent academic accomplishments over several years. He has trained in United Kingdom, has trained in US and worked there, and finally has come back to his homeland and is now practicing in Ernakulam. Above all this, I think he was my postgraduate and one of my favorite ones. And I'm meeting him after a long time. It has been a pleasure to meet him and have him here with us. He is now, apart from practicing medicine, also an author, public educator, scientific advisor, and past president of Indian Medical Association. He is going to talk to us about a very important aspect of this pandemic, which is science communication in the pandemic. And this is the era of social media, and they are the default providers of information. So Rajeev, over to you. Tell us what you have to say.
Let me start the story of Jacky the dog and the train. We know that in India, dogs love to stay in train stations or railway stations, as we call them. Now, Jacky the dog was so smart that she lived in a small town railway station. She used to get annoyed when trains would pull into the station because they blocked her view. Jacky discovered that if she barked at the train would start moving and go away, clearing her view. Jacky believed that it was her barking that made the train go away. Jacky presented her findings at the local doggy conference, and the other dogs refused to believe her. They said, "How can it be?" So Jacky said, "Try it yourself." So these dogs went back to their respective railway stations. They barked in the train and they found that the trains actually moved. So they all believed that it is their barking that made the train move. So then this went on for a few months until Julie, the wise old dog, came to the town and she questioned their findings. She said, "This is nonsense. You guys are all wrong." Then the dogs protested. "Look, we know it works. Why are you questioning us?" Julie said, "Try not barking for a change." So dogs obeyed Julie, and they found that even if they did not bark, the train would move just as they did when they barked. Correlation is not causation. Now, if you don't remember anything else from my talk, remember this. Just because two events occur at the same time, seemingly related, one need not cause the other. The human mind is so gullible that you just have to go to any magic show to discover how gullible our minds are. Magic works only because we are gullible. In the context of the pandemic, this dog story is so profound because COVID-19 has a very high spontaneous cure rate, which means that even if you do nothing, 80% of the patients will get better. It is therefore easy to be fooled about treatments that seem to work. Polypharmacy, unfortunately, is rampant. I have blocked the picture of a prescription by a doctor in India for privacy reasons, and this patient with mild symptoms got 13 medications and an order for a HRCT scan. This patient had mild COVID. There is one antiviral, and Priya would be furious to see number 2 and number 3 because she advocates rational antibiotic use. Because if you use antibiotics in the wrong context, you're going to make the patient worse, and it's terrible for the community. You're going to promote antibiotic resistance. Ivermectin, steroid, acibrofilin, you name it. I know the talk is constrained with time, so I can say I can cross out 13 out of the 14 because there is no evidence that any of these things will work. And as Priya said, some of these can be harmful. So I will just say number 13 is good. If the patient has a fever, yes, some paracetamol, plenty of fluids, and plenty of sleep. Here's another prescription written by a very enterprising doctor, again from India. This doctor has created another list, again, the magic number 13, 13 medications for COVID-19. For what? So none of these things are effective or needed, and some of them can be dangerous. I represent also the Indian Medical Association. I'm an office bearer, and this is a letter from the IMA that says rational prescription is part of medical ethics that all doctors are bound to follow. The role of doctors has been changing in the pandemic. Now, this is just a collage of things that a doctor would do. We treat our patients, we read, we have to read a little bit more in the pandemic. And the pandemic itself is a collage of around 15 medical topics, including medical ethics, pharmacology, epidemiology, immunology, genetics, virology, critical care medicine, pulmonology, hematology. And we need to know a little bit of culture. Communication is the most important, in my opinion. You see the bottom, it's communication. And if you see the pyramid, the flow of scientific knowledge. Doctors know a lot of science, but the question is it reaching the policymakers? Is it reaching the media? And more importantly, is it actually reaching who it is supposed to reach? It's okay for doctors to discuss big things in their closed forums, but what we must ask ourselves as doctors is how much of factual knowledge is reaching the general public, and also are we also communicating wrong information based on biased knowledge? If for some reason this flow is blocked, guess who will fill the gap? This gap will be filled by fraudsters that Dr. Kang has very elegantly described. She took a lot of time to describe how certain fraudsters are creating such misinformation or disinformation that is confusing everybody. Fraudsters are better than most doctors because they have excellent communication skills. They can communicate better than anyone that you can imagine. They can make you believe anything. Now, they prey on certain buttons that we have, and those buttons are emotion, anger, fear, and the hope for a miracle cure. But I'll take a little bit of time to go through the neurology of these two phenomena. I would like to emphasize that science and belief are completely different entities. And what you believe is primarily related to what's going on in your limbic system, which is involuntary, it's connected with emotion and very abstract. It's considered to be the primitive part of the brain, whereas the frontal lobe, which is what makes us the science-based progressive society, is mostly called the neocortex, and I've labeled that in green. So science is green in the frontal lobe, and belief is blue in the limbic system. The two are different. This is the fundamental reason why doctors have difficulty in reaching across to certain people who have fixed beliefs. They say that a lie can travel halfway around the world, while truth is putting on its shoes. And while communicating, here are some challenges that we face as doctors. Firstly, the most favorable opinion. See, the public always goes for the most favorable opinion. If somebody says masks are useless, the public would be inclined to follow them. If somebody says vaccines are dangerous, the public would say, yeah, great, I don't need to get my shot, and so on. And then in India, we saw that what is called the Indians are different. You know, when we started working on the pandemic, before it hit the country, some of us were called insane because they thought India was completely different. They felt that even doctors in our community felt that Indians are completely immune from diseases like viral diseases. I got personal calls from prominent physicians saying I was completely wrong in assuming that the pandemic would even come to India. Now that is the level of the rhetoric, and Indians are different doesn't work. We are no different. We are the same species. We have the same biology. And then I see what is called the in my experience attitude. You see, what is your experience worth? If you've treated 10 patients, is that worth a randomized controlled trial that painstakingly looked at 400 patients or 1,000 patients in each arm? It is not. So we have to get over our cockiness and say, this in my experience does not work in science. And then I hear the no harm giving it excuse. This is an exclusively Indian mentality. What's the harm in giving it? Excuse me, have you monitored these patients after giving that medication? No. The patient walks in the door, spends 2 minutes in your clinic, and walks away with a prescription of 13 pills. Have you monitored this patient? No. You might never see the patient ever again. So how do you know there is no harm in giving it? So Priya is absolutely right in saying that some of these medicines that are commonly prescribed are harmful. How to reach out? There are so many mediums out there, and it's better to, like in investing, to have some diversification here, because not all people can be reached through all media. Now, while communicating, be prepared to get your feet wet. It's not an easy job. You will get some brickbats, and these are people who may get offended by your statements. They may mistake your statements for a political flavor. They may be anti-science people who are offended, or they may be just doctors who are offended that you oppose their favorite drug view. And they may be plain random people who have nothing better to do than to just argue on Facebook or on Twitter. So I'll explain to you how to communicate with these people, because I've been doing this for a long time. The first thing to remember is when you communicate on social media, texting has no tone. Now I teach communication. This is so important. So when you read text, you may attribute an emotion that was never meant, or a sentiment that was never meant. And it's very easy to go into angry discussions without knowing this fact. So how to face a heckler? My style, again, this is not evidence-based, this is personal experience. How I face a heckler. A heckler is someone who unnecessarily starts an argument for argument's sake. I give them one solid response, which is absolutely assertive. I don't hold back. Don't hold back. But at the same time, be courteous to the extent possible. And I always try to find a little bit of common ground. I explain why the original statement was correct. And I never get drawn into long discussions, no matter how tempting it is to go and argue against each point that this person makes, and never, ever respond to a name caller. So here is an example of how I responded to a heckler. On the left, you see, he says, what a stupid study, and so on. And he used some other, not so polite words. So in the middle is my response. You are welcome to discuss your views on my thread, but only if you promise to use civil language and show the courtesy to understand what the thread is about. Surprisingly, see the response? The person apologized. That's a gentleman. I use the Godfather's quote often. In social media, when you're faced with an unknown enemy, never hate your enemies. Because if you get your emotions worked up, you will get drawn into an unnecessary discussion. If you don't hate your enemies, your response will be measured, accurate, and it will be widely read by others that follow you. And your stature will only be enhanced. Some hoaxes are best left alone. I don't have a lot of time to discuss this, but just to say that if you go after every fake news that comes, you may be amplifying them instead of suppressing them. So be very aware of what is called the paradoxical effect of battling every hoax that comes your way. Now, I'll take you in the latter half of my talk, I'll take you through some examples I use to communicate. There are people who believe that herd immunity is fine, and I don't want to take the vaccine because it's safer to get the virus, natural infection. I tell them this, very easy. You take 100,000 people with the vaccine, you take 100,000 people with the virus. In the first group, 1 person is hospitalized, 0 deaths from the vaccine. In the second group, 10,000 people get hospitalized and 1,500 die, depending on the age group. Now, this is plain as water. It is so clear that you don't have to explain it even further. And then there are people who take simplistic views on the immune system. I've been working on this so hard. I spent hours trying to read and understand the immune system. But people say, let's give an immunosuppressant. Or why don't you decrease your immunity? People who take simplistic views must see this. How I communicate with them is, the immune system is like the chessboard. If you try to play chess without knowing what each player, each chessman will do, you lose the game. So you try to mess with immunity with limited knowledge, you're going to create a bad outcome. So be very afraid, be very measured, be very careful about using immunomodulators that you know nothing about. So that's about immunology. Thomas wanted to post some of my notes. Thomas, this is for you. These are my notes on immunology. Again, I put it up here just to show. I scribbled my notes. Thank you. Whenever I add new knowledge, I add this as diagram. So I think virtually, pictorially. So this is my diagram. Again, to show people that immunology is not an easy subject. To the left is innate immunity, and to the right is you will find adaptive immunity. All right. Simple ways to communicate. You see this woman is trying to show a smoke tube in a theater. You see the air is still in the theater. So you can easily catch an infection because the smoke just stays in the air. This visual is so powerful, you don't have to say any words to explain that in a closed space, you can pick up infection. These are some diagrams. Again, thanks to Thomas who wanted me to put up some diagrams. Again, to educate people that if you do this, and you pinch up the skin, you may end up injecting into the subcutaneous tissue. And very, very rarely, that needle could go into a small blood vessel. So here's a picture. You see that? You see how the skin is being pinched up. So the tip of the needle is nowhere in the muscle. See, this is a common mistake. So we need to get out there and educate people that this is wrong. And this is a new technology called Twitter Space that I used a couple of days ago. This is a diagram on Facebook. I used it in a Malayalam text. I used it for common man because the common man doesn't know what the lungs is. They don't understand what an alveolus is, and they don't understand what mucus layer is. So that green yucky thing is a mucus layer, and you can see it went up to around 750 shares, which is pretty big for my standards. And this diagram, all of you must have heard from me a million times. I didn't make this. This is the universal diagram for protecting yourself from any hazard. Forget the pandemic. So elimination, the lockdown that's happening, it's eliminating the source. The less number of people come to you with the virus, the better you are. So it is not just the mask you're wearing. It's not the PPE that's protecting you. Metaphors, I use them quite a bit to explain how vaccines work. For example, I tell them that COVID-19 is a wide range from 0 to 160 on a speedometer. 0 to 60 is your safe zone, and then your 60 to 180 or 160 is your danger zone. That's a severe COVID. So I tell them vaccines will erase the severe zone. You could still get COVID-19, but 0 to 60 is your safe COVID. So you know what? In 2 seconds, you can explain this to an audience who doesn't really understand a lot of science jargon. Here's a more complex explanation. A common question that all of us are going to get is, look, a lot of people are testing positive after vaccination. Does that mean vaccines don't work? Why don't we just stop vaccinating everybody? People are getting COVID anyway. How do you get to that? In people who don't understand immunology, you need to really talk in metaphors. Metaphors are basically examples that people can easily relate with. But using a wrong metaphor can create the opposite effect. So choose your metaphors very carefully. How I answer this question is as follows. Okay, you got the question. Somebody tests positive after vaccination. How do you explain that? I tell them, look, if you hold an umbrella in light rain, you won't get wet. You're safe. But if you hold the same umbrella in torrential rain, you will get a little bit wet. Likewise, vaccines protect against most cases, but some people still get sick. So does that mean you should stop using the umbrella? That's a good way to get across to people who may not understand T cells and B cells and innate immunity. This is a common graphic that I use, again, to show people that if you hang around with more people in a closed space for a longer time and you talk and sing without masks, you're going to infect everybody. And the opposite is true. A larger space, less people, shorter time, and less talking with mask on, it's good for you and good for everybody. All right. A problem with society in general is they believe anything that's printed. So with social media, everything is printed, so they think it's true. This is wrong. We need to educate people. We need to also educate people about what does not work. And Priya showed very clearly in her last slide what does not work. And you can also already see some defensive responses coming up in the chat box. Drugs like ivermectin have a cult following. They fall into what is called the belief chamber of the brain. People are emotionally attached to this drug and they believe it works. Once you believe it works, it's impossible to convince people it does not work. The same story with chloroquine. The makers of ivermectin, the people who created it have come out and said, hey, it doesn't work in this condition. All right. Modern medicine is ever changing. Let's be humble, because what makes modern medicine modern is the fact that we keep self-correcting. We look at what happened. A lot of things, what we believe now is probably wrong. And in the years to come, excuse me, it'll be proven wrong. And that's okay. That's what modern medicine is. Do not fall, dear doctors, into what is called a favorite drug trap. Never fall in love with any medication. Science has no emotion. Science is nothing but facts. Don't invest yourself into thinking that your own theory and your own drug is all that is the truth. All that glitters is not gold. And my last slide is, we may be watering our garden, but question is, are we reaching the roots? We may be communicating amongst ourselves in scientific forums, but is our communication reaching the roots, the grassroots level, the common man who needs our help? Thank you.
Thank you, Rajeev. I really am going to take back some of your tips in future and implement it. I think this is a terrific lecture with many practical tips. Thank you very much.
Thank you.
So now we have a lot of questions. Unfortunately, we have